Hi, everybody.
Hello.
Hi, Michelle. Hi, Dr. Blue.
So I wanted to just make some introductions about who we're talking with today about LGBTQ family building. Dr. Alison Bloom is a specialist in reproductive endocrinology and infertility at Mainline Fertility, which is a clinic based in Bryn Mawr and other locations in Pennsylvania. Dr. Bloom is experienced in the field of in vitro fertilization with a particular interest in recurrent pregnancy loss, polycystic ovarian syndrome, egg freezing, and LGBTQ family building. In addition to her medical training, Dr. Bloom earned a master's in public health and is an advocate for fertility awareness and education. Dr. Bloom and her wife underwent infertility treatment for over a year before successfully conceiving with IVF and welcoming twins into their family. So welcome, Alison.
Thank you.
We've also got Bonnie Douglas. And Bonnie is a senior case manager here at Donor Concierge and works with many of our LGBTQ clients, helping them to match with egg donors. Bonnie's a former human rights attorney from New Zealand with experience in native law, human rights, immigration, and commercial law. And Bonnie now has two busy little boys who keep her on her toes. So welcome, everybody.
Thank you for having
Thank
us.
you.
Yeah, I think it's a really important topic, obviously, as the world changes and families, are made up of very different, we have different, it's not so much traditional family anymore, it's family from all different types of people. So I really wanted to start off asking you, Alison, about Mainline Fertility and your approach to fertility care for the LGBTQ community.
Sure. So obviously my particular interest is working with all sorts of patients, but particularly the LGBTQ population, just because of my own life experiences. And I feel very fortunate to be a part of their journeys. I feel like I'm able to bring my own experiences to them, both as a physician and also as sort of an advocate, and, just give them advice as if it was me going through it. I think I've really tried to make sure our clinic and our center is very LGBTQ friendly. And even when I arrived here, I think we have always been, but we continue to grow and learn. And I think that's a piece of the puzzle, that if you don't continue to do that and educate your staff and the people around you, because we know the fertility journey, especially with surrogacy and donor eggs and donor sperm, is really takes a team to get a couple or a single person pregnant. And I think we are getting better at it every day. And I'm really excited about the enthusiasm in our office to really make this really a little niche that I have. And I'm excited about it.
What sorts of things, when we're like Bonnie and our team, we help people find a fertility clinic. And so if they're going through donor conception or surrogacy for two dads, for example, what kinds of things should a patient look for in a fertility clinic to know that they're friendly?
Yeah, I think definitely a fertility clinic that has experience with working with gay couples. I think that more and more, thankfully, most fertility clinics are accepting gay patients, and it has become the norm, thankfully. But I think it really takes, a community, again, of everybody from the front, the people who answer the phones, to our front desk, to our nurses, to our physicians, lab, and all those extra people that make their journey work, to truly understand that their journey is much different than the average person or the straight couple that comes into our office. Oftentimes, gay couples know that they need our help without they don't technically have an infertility diagnosis, but they rely on us to be a part of their journey. And I think having a clinic that has a lot of experience doing that is exciting. For me, I don't necessarily think you need a gay provider, but being an open gay provider, I think, brings something special to the table. And it's exciting for me, again, to be a part of their journey.
That was my question for you, Bonnie, because you were nodding your head. What sorts of things, when you're working with gay couples, for instance, do you tell them to look for in a clinic? What are you looking for when you're helping them find a clinic?
Yeah, it's a great question. I think just basically what Dr. Bloom said, but making sure it's somewhere that they're comfortable with, obviously a clinic that's, often I work with gay male couples for the most part. And so, finding a clinic that is used to working with gay men, and that they're going to really feel kind of at ease at. Sometimes they want somewhere close to their home. Other times, you know, that's less important, but, you know, somewhere that's used to working with gay couples, that does a lot of donor cycles. So there won't be any surprises. And really where the communication is great, where we can communicate with the clinic, and the agency can, you know, communicate with the clinic. And frankly, you know, especially with gay couples who want to have 2 sperm sources, I think having a clinic that will review records is super helpful, you know, to give us that feedback and make sure they're going to find a good match. Can avoid a lot of delays later down the track.
Actually, that leads me to the question about finding an egg donor when you're 2 male couples. Are there specific things, Allison, that you look for or you suggest they search for when they're looking for a donor?
Yeah, I mean, definitely. I think we all know that this is a very personal decision, whether it being looking for a donor egg or for a female couple or a single woman looking for donor sperm. Ultimately, that egg is going to contribute to the biology of their child. And, you know, the simple things where some people might think looks or ethnicity or religion are important to some people, for other people, that is not as important. And I think it really is a very personalized journey to pick the right egg donor, not only for the individual, but for a couple, if there is a couple. I think also, you know, down the road, especially if they're going to disclose this donor in some way to their child, like they should be proud and want to talk about the things that this person had interest in or what this person was like. And, you know, some of that is through paper, but I feel like we do get a lot of information on donors these days about their personality and likes and interests and stuff. So I think those things are all stuff that couples can take into consideration. You know, some of the medical stuff, we always look to make sure they're genetically compatible and make sure that they're not carrier for a recessive disorder, that then whoever's providing sperm, or if both partners are providing sperm, we have to make sure that they're not also carriers. So from a medical standpoint, there's some logistical things. And of course, when we bring donors through, we have our own donor bank. So we use fresh and a frozen bank, but also encourage people to look anywhere because we want them to be confident with their decision. You know, when people are getting, or when we're using donor eggs, of course, those donors are already meeting some basic criteria, or not even basic, very extensive criteria. But then I think we're looking for more of the personal reasons why someone or a couple chooses a donor.
Is there anything medically that's specific to, say, 2 sperm sources? You know, if so both dads want to have 1 egg donor, but they both want to be bio dads, maybe they're going to do 2 surrogacy journeys. Is there anything that you look for in a donor, or do you encourage them to do maybe 2 cycles with the donor? I'm thinking of AMH levels, for instance.
Mm-hmm. Well, most of our donors are going to have good AMHs. We don't choose donors unless we think that they're going to make a lot of good eggs. So if we're going through fresh cycles, a lot of men will choose to do 1 donor cycle and split the eggs between each partner. There's always the opportunity to do another cycle, but I don't set people up with a donor to think that they're going to need more than 1 cycle. We create embryos, so we see how many embryos there are. If they desire to do genetic testing, they'll do genetic testing. And at the end of that whole process, we'll basically say, okay, you have X number of embryos with partner 1, you have X number of embryos partner 2. How many children do you want? Is that enough, or do we proceed through another cycle? The limitations of then trying to get pregnant and coming back is that donor might not be available again. So we sort of have to think about, is this enough? And there's never a 100% answer, but we sort of make an informed decision about, do we go back and do another cycle or not?
And when you're talking with them at the beginning, you know, does the question of like, who's going to be whose sperm is going to be for the first cycle or the second cycle, do you have that conversation? There's some, and we're going to be doing another webinar with a therapist about making those decisions, but is that a hard decision to make for them?
I think it's a very personal decision. And I think for men, because sperm is not as affected by age until much older, there's less of a biological reason for one to go first, unless there's some other medical condition or something where we foresee someone might have a shorter lifespan than another. That might be a good reason. But for most male couples, they've decided together, they already know who's coming first. I think it's very different for women. When I see same-sex female couples and they're thinking about doing reciprocal IVF, and they both want to use their own biological eggs at some point, I tend to work them up together and come up with a plan based on their fertility evaluation and their age to see, well, really, who do I think should go first? They may come in with a preconceived conception of who's going to go first, but from a medical standpoint, I might say, you know what? I know you guys think this, but I really think partner A should go first because of these reasons. And then they still ultimately have the decision, but I feel obligated to at least evaluate them together.
So it sounds like there's a lot of education. And Bonnie, when you're working with male couples, for instance, what do you think dads need to know about egg donation as they start? Maybe they've had their initial consultation with Dr. Bloom. Then what? What do you tell them about when they're looking for a donor?
Yeah, I think that the biggest thing we share with them is to try and find someone who, they feel could fit into their family in some way. So, maybe not necessarily identical to the bio dads. I mean, often they might look quite different from each other, but someone who, could be a cousin or someone in their extended family, so that when there's a family photo, the child isn't kind of the odd one out, so to speak, and looking vastly different from the rest of the family. And I think sometimes they come in with quite set, someone in their mind, basically, whether it's someone in their family or maybe a friend that they think would be the perfect donor. And so it's kind of educating them to look at the donors for who they are and look at their own merits, because often, someone that they might, that when they first look at them, they might not think that would be a good donor for them, and often those ones who they didn't expect would be the perfect donor turn out to be the one they actually choose. So yeah, just kind of setting that expectation that, look at who's available, look at who we present to you and see and kind of assess them individually for who they are and see who might be the best fit for your family based on who's available at the time. Yeah.
I was going to ask Dr. Bloom about what you talked a little bit about to women families and talking about reciprocal IVF. Do they always do reciprocal IVF, or how do you approach that?
So when I first meet with a same-sex female couple, we really talk about, a lot of times they've had these discussions before. So we talk about, do you both want to use your eggs at some point? Does one partner want to carry? Do both partners want to carry? And it depends on what they tell me in those initial conversations as to how we proceed. Lots of same-sex female couples will come through and do intrauterine inseminations initially, but more and more we're seeing with IVF picking up and those options being available for people, that people really like the idea of both partners being directly involved in a single pregnancy. So often we'll see a woman come through and we retrieve eggs and we might create embryos and transfer them into a partner. Often only one partner wants to carry. I see that a lot. So sometimes then we'll do eggs from the other partner, but transfer into the same woman. So intrauterine insemination, of course, the same woman's eggs, the same woman's uterus, but with IVF, really the possibilities are unlimited. We can do one into the other and then retrieve the other and put the embryo into the other. So they're both sort of nature and nurture through both pregnancy. Or a lot of times one woman will want to carry, but the other woman wants to participate in the egg process and the biology. So they'll do one cycle and then the other woman will do another cycle.
It seems like it's more flexible for women, same-sex female couples, I think.
Oh, absolutely. I mean, it's
Yeah.
still a journey, but not as much of a journey as for two men. I mean, they definitely have to go through quite a lot of steps to build their family.
Right. And of course, we've also got our own fertility issues to deal with too. So, all this has to happen at a decent age, youngish age. Do you think that younger women who are in same-sex relationships are thinking about that? Just
I think more and more now, I'm seeing a lot of young couples come through in their mid 20s, ready to get pregnant. I think now more women are getting married, and they're looking to start a family just like any other woman in the world. It's something that they've always dreamed of. And despite them having a female partner, they still want to create the family. And I think that's true for men as well.
when you're working with females, how do you help them find a sperm donor? I mean, we have sperm banks, we have known donation through a friend. Do you make any recommendations?
I mean, I have similar conversations as I do with the men. It's a personal decision. And when you look through sperm banks, because there's so many options for sperm, it can be overwhelming. So, we talk about some of the major large sperm banks that most people will use, although any sperm bank that does the appropriate testing, if they find a donor that they like there, it can be shipped to us. And that's not a problem. I don't want to limit them to where I think they should go. We do talk about the genetic component. We talk about CMV or cytomegalovirus virus risk, where if, a patient is negative, then we want a negative donor. We talk about things like that, but for the most part, it's who they choose, and picking someone that seems the right fit for their family, just like with men picking a donor egg.
Is it common for women to pick somebody that they know, like a friend, so it's a known donation?
Some women will come in and consider known donors. A known donor is a much more complicated, complex process in terms of either testing for that partner, FDA screening, quarantining sperm, or having sperm and FDA testing done for infectious disease before every single cycle. It also requires, just like for men, when we're using donor eggs or surrogates, legal paperwork to be drawn up. So it ends up being a more complex and expensive process. And I'll tell you, a lot of couples, when they come in where they think they might have someone that they choose to use, often end up using an anonymous donor in the end. But we will work with known donors. They just have to follow a lot more, there's a lot more steps that we have to go through to get them to use that donor.
I think that's part of the education piece. And I can again see Bonnie nodding. A lot of people come in to our company, to Donor Concierge, and they have this idea that they're going to use their best friend and it's going to be great. And we say, have you talked to a therapist? Have you all discussed this process? Have you talked to an attorney? And usually they haven't, right, Bonnie?
That's right. Usually they haven't. And usually I think, it's very sweet because they have this very kind of innocent understanding, I guess, of, how this is all going to work out so beautifully. And in a perfect world, it would. But, we want to make sure they have the resources that they need, the attorney, the therapist. And just sometimes it takes a little bit of time to accept that, that may or may not work out. And they may need to go through, a search and matching process to find somebody else. And it can be sometimes hard if they, as I kind of touched on before, in terms of if they've got their heart set on one particular known donor, to sort of look at other options, for who they individually are, and trying to kind of move away from that, because, what we say to them is, the best donor for you is one who is actually available and healthy and willing and can do this for you,
And provides the best eggs, right?
Right. And
medically.
Yeah.
Yes.
Yeah, definitely. Allison, let's talk a little bit about surrogacy. How are you doing? Are you seeing a lot of surrogacy, doing a lot of gestational surrogacy cases?
Yeah, quite a bit.
And is that increasing, do you think?
I mean, I think it's increasing just because it's something that I'm really excited about. So I'm starting to get more couples. Yeah. So, I mean, yes, I don't know if it's increasing over the US or regionally, but, we're definitely seeing a lot of men coming through looking to work with a surrogate.
And what are you looking for when you're assessing a surrogate who might be good for a male couple?
So most of these couples are working with an agency, so they'll present, carriers to us. And then we basically are reviewing their records to make sure they're a good person to carry a pregnancy. So they're evaluated by a psychologist. They have medical records, a medical release form, saying that they would be a good candidate to be a carrier. We also usually have their delivery records. So we want to make sure that these women have had normal deliveries in the past without complications, and that they have a good support system at home. If they have a partner, that the partner is supportive of this process, because obviously they're directly involved in this process. And we're just looking for red flags, people that we don't feel would be a good match, because ultimately the patients are our client and our patients, and they come first. So if I see something in a chart that is concerning for me, I might say, let's see if we can find someone better. And it's not in a way of a rejection. It's a way of trying to provide the best person for our patients.
Right. And at Donor Concierge, when we're looking for a surrogate, we're always following ASRM guidelines, and we're looking at BMI, number of deliveries, number of, if there's been any C-sections, so no more than 2 for us. Is there
Right.
anything specific that you're like, specific things like a BMI level, or you just?
I think we're following those, plus just looking in very much detail at their records to make sure there's other things that we're not uncovering that are a concern.
Yeah, and I think that now there's just so many agencies out there too. It's very confusing for people, and I think it's a longer our process, we always wait until the embryos are formed, then we start searching for a surrogate, because we want them to be ready to go.
Right.
And also a lot of the education piece, as Bonnie can attest to, there's a lot of education that goes into the surrogacy and about the surrogacy, the relationship with the surrogate, as you know, and making sure everybody's on the same page ahead of time.
Absolutely.
It's really important, isn't it? Do you have those conversations with them about what they can expect?
Yeah, I think it's probably one of the most important decisions, because you're so directly involved and they're carrying your child. So I think that trust is the biggest thing that you have to look for, and the ability to communicate with this person and set out very clear guidelines and expectations about their involvement during pregnancy, their involvement at delivery, what it looks like after the child's born. You just have to truly like the person, and just I just really tell people, make sure you're on the same page. And, this is a long process for a lot of male couples, and I think they're all eager to move to transfer, but it's the most important piece of the process, I think. And if they're not comfortable and don't have a good relationship and trust with that carrier, it's going to make for a poor experience, with their pregnancy and beyond.
We have a question, and the question is, what does an initial consult with a same-sex couple look like?
And I don't want to assume, can we talk about a same-sex male couple or female couple?
Let's go with male.
Okay.
We talked about females, actually. You did touch on that a little bit. So let's talk about men.
So typically a lot of it is education, because if we're using a same-sex male couple, it's a lot of what we're going through right now, because ultimately what I need from them is sperm, and we're not going to find that out at their initial consultation. So we have a conversation. We talk about all the different options in terms of using a donor, using a fresh donor, using a frozen donor, agencies. I also agree creating embryos before signing up with an agency is important, because an agency can move forward and have a carrier for you, but then we don't have embryos created. So I think that's important. We talk about the process of IVF. We talk about the process of, eggs developing into embryos. We talk about the transfer cycle. I have to say it's about an hour long of education. Of course, I take a medical history, but for men, most of these men are young and healthy, and I just need to make sure that they have sperm. So after that initial consult, they will set up a consult and meet with our third party women, there we go. They will set up a third party consult with our third party team to talk about some of the more intricacies of getting a donor egg. And then we will bring them in for screening blood. So really infectious disease testing, as well as an initial semen analysis for both partners if they're both choosing to use themselves as sperm sources. And then the next process is really finding an egg donor. So will it be with us in-house or outside? And then we kind of take it each step at a time. But for men, it's it's really a large education session, I would say, for the first visit.
Yeah, and I would think, Bonnie, we again, we talked about it, but we take a step-by-step approach. Let's start with have you had your sperm analysis done? Have you had any genetic testing done? And that's information that we can use when we're looking for a donor as well.
Sure.
We're not making the assessment of the donor and her genetics. We're going to pass that on to the doctor to review.
Right. So we'll go with that. So this is where I was saying, what kind of couples. So for trans women, basically for trans women, I really encourage trans women to freeze sperm before transitioning. And I've actually been doing a lot of that with young teens these days, because once a biologic male starts taking estrogen, it is very detrimental to sperm production. And we don't really see, even coming off the estrogen, that sperm really functions well, or there's a lot of it. So for trans women, it all depends on how their partner identifies and their biology. So if they have a cisgender female partner, then we would usually talk about donor sperm with inseminations to that partner. Or IVF with that partner. For trans men, a lot different. So we will talk about fertility preservation in trans men prior to transitioning. However, we do see that coming off testosterone for a short period of time, if they still have their ovaries, then we can actually bring them through, either stimulate them and do inseminations if they want to be pregnant themselves with donor sperm or a cisgender male partner, or bring them through IVF retrieve eggs. So testosterone stops for a short period of time, bring them through retrieval, they can get right back on their T, and then create embryos either with donor sperm or partner sperm, and transfer either into a cisgender female or a trans male that has a uterus, or a carrier. So it all depends on biology and what organs they still have or don't have, as well as their desires of how involved they want to be in the pregnancy in terms of biology and or carrying a pregnancy. Does that answer your question?
Yes, and I see that was a question from one of our attendees, which is great, because I wanted to talk about trans care, because we've seen a number of our clients come through who are trans individuals, and it's been really exciting to help them, because they have that insurmountable, challenge of the transition itself, but also the idea that they can now have children is amazing. So that's what and when you are working with somebody who's either transitioning or thinking about it, do you get involved? What stage do you get involved? Are you involved through another medical provider, or do they come to you first?
So typically what I've been experiencing is getting referrals from other docs. So, I have a network in the community of docs that know that would like to work with trans patients, and they're using me as basically a resource. So a lot of times, a lot of these, and I want to say kids because they're young, I'm seeing people in their early teens, most recently 16, 17, 18. So adolescents that are about to transition, haven't started meds yet. And thankfully, a lot of the doctors in our community that are doing trans medicine are very, very good about talking about fertility preservation, especially in our male to female transitioning patients. And I've just been seeing these children or adolescents, and usually, thankfully, a support person. So often their mom. And we have a conversation about fertility preservation and how we could potentially use that sperm in the future. with depending on who they choose as a partner. And we typically bring them in for some evaluation. It does require bloods. And then they usually will freeze twice within 1 week. That way we have adequate sperm for them to use in the future in multiple different ways. For trans men, so people transitioning from female to male, a little bit different. Still really applaud the practitioners out there now to talk about fertility and really talking about fertility preservation prior to undergoing surgery. But the initiation of testosterone doesn't seem to hinder the ability to conceive in the future in multiple different ways. So that doesn't seem to be, because freezing eggs is a lot more expensive than freezing sperm. So for a young person, that's not often an option. But it's nice to be able to at least tell these patients these are the options. And in the future, prior to considering surgery or removal of the uterus and the ovaries, really come back and consider your fertility preservation in the future or your fertility, desires before moving forward on that, because that is really going to limit what they can do if they go through that surgery.
And I suppose the benefit is that they're young, so their sperm's probably pretty healthy. Their eggs are pretty robust, so they're not facing that challenge that many of us have gone through when we've had to have IVF.
Right.
So
exactly.
That's good. Yeah,
exactly.
That's amazing. And that's one thing I think I've really noticed in since working in this field is the number of people who have options when they're going through transition too. I don't think that, Bonnie, I don't think 10 years ago we saw people going through fertility treatment when they were transitioning. So this is amazing. What else have I missed? Tell me more about your practice then, Allison.
That's really put me on the spot.
I know.
I feel like we've covered quite a bit.
We have, yeah.
Yeah, I mean, we have a really great team, our third-party team. I feel confident any couple or person who comes in needing to use donor products, even our straight couples who need to use donor products. I feel like we really have a great team that have been doing this for a really long time, and we work with every agency and are open to working with just about everybody, which is nice. I don't feel like we have a lot of restrictions on who we will consider to move through our program, which is really nice, because if someone wants to have a family, they should have the ability to start a family. If
Definitely.
it, based on their sexual orientation or their gender identity or even age, they should still have the ability. So it's nice to be able to help them out. And I just truly love what I'm doing. And I love being able to be a part of this process, especially in this little LGBT niche. Although, of course, I love all my patients dearly, but it is fun to have sort of gone through it and had such a long infertility journey, not anticipating that. So, often people come in, and actually this is something I can speak to is, we didn't think that we were going to have an infertility issue. We had what I say is a male factor, right? We didn't have sperm. So what do? You go get sperm and you get pregnant. Well, doesn't always happen that way. And I have lots of single women and same-sex women and that come through, and, we find out that there is an infertility issue, or the traditional inseminations, which they thought would come in and do 1 or 2 inseminations and they'd leave with the baby, doesn't always run that way. And IVF is a wonderful thing that we have the ability to offer people, but IVF is not 100% guarantee. And you see these men who go through a lot to get through this process. And, we can't deny, spend a lot of money. And not every egg becomes an embryo, and fertility and reproduction is really inefficient, unfortunately. But we're all doing the best we can. And I think if they have, are well educated and ask the right questions and feel confident with their providers and the people they're working with, hopefully there's no surprises. And hopefully at the end, our goal is to build the family that they foresee themselves having. And
there's a question, where's your office located? And how just tell us, how does somebody get in touch with you? What's the first step if they want to? Do you offer a consultation on the phone, on Zoom, or what?
So if they go to mainlinefertility.com, I don't know if you want to type it in the chat.
I will.
They can request an appointment right on there. And they can put a specific doctor, or one of our fertility care people will get in touch with them. And then we typically have forms that they'll fill out. And then we usually set up our initial visit, especially with COVID these days, is through Zoom. So we do a Zoom consult. We talk about all the options, and depending on where they're going to move forward or how they're going to move forward, then we'll sort of figure out when they come into the office and what steps are being done virtually and in person. Of course, what we do, we have to see people, but with the initial consults, we do via Zoom these days. It's in the Philadelphia region. So I am in Philadelphia, Bryn Mawr, and Havertown. So all within a half hour of downtown Philly.
And is there a cost for the initial consultation?
So the initial consultation is typically covered by your insurance. So we just bill to the insurance.
Got it. Got it. Great. Any final thoughts? Because we've actually covered a lot, and I'm surprised that we got through it in such a short time.
I'm a fast talker.
Or if anybody has any other questions, let us know. Thank you so much.
Yeah, thank you for having us. This was fun.
Yeah, it was. Thanks, Bonnie.
Yeah.
And I will we'll get this up on YouTube. So if anybody hasn't seen it, it'll be on YouTube and with all your information as well. So we'll do that.
Great. Thank you so much for setting this up, Bonnie. Nice to meet you. And if you guys need us for anything, I'm here for you.
Absolutely. Thank you.
All right. Take
Bye.
care. Bye.
Yeah.